Most mothers spend months preparing for birth. Very few are taught how to recognize when something may be wrong after birth. And that is definitely a problem because while postpartum recovery is normal, some symptoms can signal a serious complication that needs immediate medical attention. In fact, most maternal health complications happen after a baby is born and not necessarily during labor. Most of the maternal deaths that we hear about, they happen within that first 6 weeks after baby is born. So today I'm gonna share 7 postpartum symptoms that you should absolutely never ignore. Whether you're currently pregnant, you recently gave birth, or you're supporting a postpartum family, this information could definitely save a life. So let's get started. So first, we're gonna start with postpartum bleeding. Bleeding after birth is definitely expected. Your body is healing, you have lochia, the discharge that follows birth, and that is typically lasting several weeks. But excessive bleeding is different. If you're soaking through a pad in an hour or passing large blood clots, that is absolutely not something to brush off. Heavy bleeding can indicate postpartum hemorrhage, which remains one of the leading causes of maternal complications worldwide. If you experience sudden heavy bleeding or dizziness, weakness, or fainting, you absolutely need to get in touch with a doctor, go to your local emergency room, but you need to get medical attention immediately. This is your body telling you something important. Now, when you are actually in the hospital, immediately after birth, that's one of the things that they're looking for. Hemorrhaging is another word you might hear, but it's pretty much excessive bleeding. But outside of that space, it's really important to know what to look out for and what is too much. One of the next things to look out for is severe headaches. Many new mothers experience headaches for a myriad of reasons: lack of sleep, dehydration, stress, hormonal changes, that can all contribute. But a severe headache that absolutely doesn't improve once you get rest, once you get hydration, or medication, that's something that definitely deserves attention. So if you are having vision changes, swelling, elevated blood pressure, or dizziness, those are signs of postpartum preeclampsia. A lot of times we hear about preeclampsia during pregnancy leading up to birth or possibly even with a C-section intervention, but you can also experience preeclampsia postpartum. Many people don't realize that preeclampsia can develop after birth, even if you didn't experience it during your pregnancy. And that's where this condition can become life-threatening because it could more easily be left untreated. So if you feel like something is wrong, you need to trust yourself. If you feel like things aren't normal, you're feeling off kilter even in your balance, these are all things, and it means that you need to go and get yourself checked out and be seen. The next symptom is shortness of breath or chest pain. Now, this absolutely, you need to go into an ER, a doctor immediately. It requires immediate attention if you're experiencing this. Chest pain, difficulty breathing, shortness of breath, rapid heartbeat. This is not just something that you should attribute to being out of shape or, oh, I just did the stairs. You absolutely need to seek emergency care. This could indicate a pulmonary embolism. That's when a blood clot travels to the lungs. It's not necessarily super common, but it's absolutely life-threatening. And so many mothers dismiss these symptoms because they're just trying to take care of everyone else. They're just trying to function. But I need you to remember that your health matters too. Do not wait. Get it checked out. If it turns out to be nothing, awesome. But if it turns out to be something, taking that action could literally save your life. The next symptom is fever or signs of infection. So your body has just gone through an amazing event, giving birth. And any infection during your recovery definitely deserves to be checked out. So if you're experiencing fever, chills, any kind of foul smelling discharge with the lochia in any of the discharge that you're experiencing post-birth, it should not have a foul smell. Increased pain in the pelvis or really anywhere in your body, or redness around incisions or tears, particularly if you've experienced an episiotomy or any other suture anywhere. These all indicate infection in the uterus, at your cesarean incision, a urinary tract infection potentially, or it could be something else going on in another part of your body. So the biggest thing with infections is that they're typically very treatable if you catch it early enough. But if you ignore them, this is where things can get really serious and complicated. So any sign of fever or any signs of infection, you need to get checked out by your provider. This next symptom might be a little bit hard to admit and to talk about. So if you're feeling extreme sadness or feelings of hopelessness, you need to tell someone. It's time for us to talk about mental health. Many mothers experience baby blues during the first couple of weeks after birth. There's mood swings, there's crying, there's emotional sensitivity, and all of those things are within the realm of normal. But if you have persistent feelings of hopelessness, despair, severe anxiety, isolation, or even feeling disconnected from your baby, those are things that absolutely should not be ignored. Postpartum depression and postpartum anxiety are medical conditions. They're not a personal failure. They're not an indication on how good of a parent you are. When you actually reach out and get the support that you need, that is a sign of strength. You deserve to be cared for as well. So maybe you have a doula in the home, maybe you have a trusted family member, your partner, your OB, your midwife, whoever it is that you're around that you feel safe enough to communicate these challenges with, you absolutely need to communicate with them what's going on. The next symptom is leg pain or swelling. If you have pain or swelling in one leg, it can indicate something we call a deep vein thrombosis. You might hear it in the medical space in terms, the abbreviation is DVT. But what you need to look out for is experiencing warmth in one leg, swelling on one side, tenderness, redness. These are all signs that a blood clot has potentially formed. And the reason that blood clots can be dangerous is because they travel through your bloodstream. They can get lodged in your lungs, in your heart, all these different places. And so any unexplained swelling or pain should be evaluated immediately. Last but not least, honestly, the final symptom might be the most important one. You are the expert on yourself. And so if you feel like something just isn't right, as birth workers, healthcare providers, and mothers ourselves, we hear this so often. Something is just off with me. I don't know. Something is just off. And many mothers report sensing something was wrong before anybody else recognized it, regardless of if they were a professional or not. So I want to emphasize that you know your body. You know when something feels off. If your instinct tells you to seek help, please listen to that. You are not an inconvenience. Doesn't matter what your to-do list is looking like and what your plans are for the day. Advocate for yourself. Ask questions of the people that you have access to. If you go and get an opinion and you feel like, they're not taking me seriously, get a second opinion if necessary. The postpartum period is often called the fourth trimester. It's a time of healing, adjustment, and recovery. So while many symptoms are normal, these 7 warning signs should absolutely never be ignored. So let me reiterate what they were. Heavy bleeding, severe headaches, chest pain, shortness of breath, fever or infection, extreme sadness or hopelessness, leg pain or swelling, and a strong feeling that something isn't right. So the goal here isn't fear. It's awareness. And because informed mothers are empowered mothers, and empowered mothers are better equipped to advocate for their health and their healing. So if you are preparing for postpartum or you're supporting someone who is, we've created a free postpartum planning guide to help families prepare for recovery after birth. You can find the link below. And if this video was helpful, please share it with another mother, partner, doula, or healthcare professional. This information can make a difference when it matters most. We'll see you in the next video.